Have you looked in the mirror today? If so, there's a good chance your eyes may have already revealed something important about your health, and you didn't even notice it. What if I told you that doctors can sometimes detect liver disease, dangerous cholesterol levels, thyroid disorders, nerve damage, vision-threatening conditions, and even signs of a medical emergency simply by looking at the eyes? The frightening part is that many older adults see these warning signs every day and assume they're just a normal part of getting older. In today's video, I'm going to show you some of the most important eye changes that could be telling you something about your overall health. And make sure you stay until the end because one of the final warning signs is commonly dismissed as harmless aging, yet it can sometimes signal a serious condition that requires immediate medical attention to prevent permanent vision loss. Before we begin, welcome to Healthy Wisdom for Seniors. I'm Dr. David, and my mission is to help you stay healthier, stronger, and more independent as you age. If you value trustworthy health information designed specifically for adults over 50, please take a moment to subscribe to the channel, turn on notifications, and give this video a like. It helps us reach more seniors who could benefit from this life-changing information. Now let's get started. The first thing your eyes may reveal is something many people have never considered: changes in how you see color. Most people think color blindness is something you're born with, and often that's true. But when color perception suddenly changes later in life, it deserves attention. If colors appear faded, dull, or different than they once did, this can sometimes be linked to problems affecting the retina, optic nerve, or other structures inside the eye. Some medications and medical conditions may also affect color perception. That's why doctors often use color vision tests as part of a complete eye examination. While occasional differences in color perception may not be serious, sudden or noticeable changes should never be ignored. Now let's move to one of the most important signs on this list. Have you ever noticed someone with yellow eyes? I'm not talking about the skin. I'm talking about the white part of the eye itself developing a yellow tint. This condition is called scleral icterus, and it can be one of the earliest visible signs of elevated bilirubin levels in the bloodstream. Bilirubin is a yellow pigment produced when old red blood cells break down. Under normal circumstances, the liver processes and removes it from the body. But when the liver isn't functioning properly, bilirubin can build up and begin depositing in tissues, including the eyes. Conditions involving the liver, gallbladder, pancreas, or blood can sometimes cause this warning sign. Many people assume they're simply tired or not getting enough sleep when they notice a yellowish appearance in their eyes. But this is not a normal part of aging. If you ever notice yellowing of the whites of your eyes, schedule a medical evaluation as soon as possible. Next, let's talk about changes in vision. Many seniors believe blurry vision is just something everyone must accept with age. While certain changes are common, persistent or sudden vision problems should never be dismissed. If reading becomes more difficult, road signs appear blurry, faces seem less clear, or your vision changes unexpectedly, your eyes may be signaling more than just a need for stronger glasses. Cataracts, glaucoma, macular degeneration, and retinal disease can all affect vision. In some cases, vision changes may even reflect neurological problems involving the brain. One simple test eye professionals often use is called the pinhole test. If vision improves significantly when looking through a small opening, the problem may simply be related to focusing issues. But if vision remains poor, further evaluation is usually necessary. The key lesson here is simple: never assume vision changes are automatically caused by aging. Speaking of vision, your glasses prescription may reveal more than you realize. People with significant nearsightedness, also known as myopia, often face a higher risk of retinal complications later in life. The retina is the delicate tissue lining the back of the eye that allows us to see. In highly nearsighted individuals, the eye is longer than normal, placing extra stress on the retina. Over time, this can increase the risk of retinal tears and retinal detachment. That's why regular eye examinations are so important, especially if you've had strong glasses prescriptions for many years. Now here's something fascinating. Some doctors can identify rare diseases simply by observing a ring around the iris. One example is known as a Kaiser-Fleischer Ring. This brownish or golden ring can develop when excess copper accumulates inside the body. It is associated with a condition called Wilson's disease, which affects the liver and nervous system. While most people watching this video will never develop Wilson's disease, it serves as a powerful reminder that the eyes often reveal clues about what's happening elsewhere in the body. Another ring that doctors frequently observe is called corneal arcus. This appears as a gray, white, or bluish ring near the outer edge of the cornea. In older adults, it is often a normal age-related finding. However, when it appears at a younger age, it may sometimes be associated with elevated cholesterol levels. Cholesterol deposits can accumulate in the cornea and create this distinctive appearance. While the ring itself usually doesn't affect vision, it can be a useful reminder to monitor heart health, cholesterol levels, blood pressure, and cardiovascular risk factors. Now let me ask you a question. Have you ever experienced an eyelid that wouldn't stop twitching? Most of the time, occasional eye twitching is harmless and related to stress, fatigue, poor sleep, or excessive caffeine intake. But persistent twitching that spreads to other facial muscles or continues for an extended period deserves medical attention. In rare cases, ongoing muscle spasms can be associated with neurological conditions. Although most eye twitching is not dangerous, your body may be signaling that something needs attention. One of the most important examinations doctors perform in emergency situations involves checking the pupils. Under normal circumstances, when light enters one eye, both pupils should become smaller. This response provides valuable information about how the eyes, nerves, and brain are functioning. Abnormal pupil reactions can sometimes indicate stroke, head injury, neurological disease, medication effects, or poisoning. Emergency physicians routinely check pupil responses because they provide immediate insight into a patient's condition. If someone develops unequal pupils, confusion, weakness, severe headache, slurred speech, or sudden changes in consciousness, emergency medical care should be sought immediately. Now let's discuss something millions of seniors notice every day: floaters. Floaters are small specks, threads, or cobweb-like shapes that drift across your vision. In many cases, they are harmless and become more common with age. However, here's where things become important. If you suddenly experience a dramatic increase in floaters, flashes of light, or what appears to be a curtain moving across part of your vision, do not wait. These symptoms may indicate a retinal tear or retinal detachment. Retinal detachment is a medical emergency because the retina can no longer function properly when separated from its normal position. The longer treatment is delayed, the greater the risk of permanent vision loss. Many people ignore the early warning signs because they don't realize how serious the condition can be. That's why recognizing these symptoms could potentially save your eyesight. Before we continue, tell me in the comments, have you ever experienced floaters, blurry vision, or any unusual eye symptoms? I read as many comments as possible, and your experiences may help others in our community. Now let's talk about something that affects millions of older adults: dry eyes. Dry eye syndrome becomes increasingly common with age, yet many people don't understand what is happening. You may notice burning, irritation, redness, grittiness, or a sensation that something is stuck in your eye. Surprisingly, one of the most common symptoms of dry eyes is excessive tearing. That sounds backward, doesn't it? Here's why it happens. When the surface of the eye becomes irritated due to insufficient lubrication, the eye responds by producing large amounts of emergency tears. Unfortunately, these tears often fail to provide lasting moisture. As a result, the eye remains irritated, creating a cycle of dryness and watering. Common contributors include aging, medications, prolonged screen use, air conditioning, environmental irritants, and autoimmune diseases such as Sjogren's syndrome. Artificial tears, improved hydration, and reducing screen time can often help, but persistent symptoms should always be discussed with an eye care professional. Another condition that can affect the eyes is blepharitis, which is inflammation of the eyelids. This condition may cause burning, itching, redness, crusting, flaky skin around the eyelashes, and discomfort. Many people assume it's a minor irritation, but untreated blepharitis can significantly affect quality of life. Good eyelid hygiene and appropriate treatment can often improve symptoms substantially. Finally, let's discuss one eye-related warning sign that many seniors overlook. If your eyes begin appearing unusually prominent or seem to bulge outward, this may sometimes be linked to Graves' disease, an autoimmune condition involving the thyroid gland. Excess thyroid hormone can affect tissues behind the eyes, causing swelling and changes in appearance. In addition to eye symptoms, people may experience weight loss, rapid heartbeat, anxiety, tremors, and heat intolerance. Recognizing these signs early can lead to faster diagnosis and treatment. So what is the most important lesson from today's video? Your eyes are much more than windows to the world. They are also windows into your health. Sometimes they reveal clues about liver disease, cholesterol problems, thyroid disorders, neurological conditions, retinal emergencies, autoimmune diseases, and other health concerns long before symptoms become obvious elsewhere. That's why regular eye examinations are one of the most valuable investments you can make in your long-term health. If something changes in your vision or in the appearance of your eyes, don't ignore it and don't assume it's simply aging. Listen to what your body may be trying to tell you. If you found today's information helpful, please subscribe to Healthy Wisdom for Seniors, give this video a thumbs up, and share it with a friend or family member who cares about protecting their vision and overall health. Thank you for watching, stay healthy, stay informed, and I'll see you in the next video.